Hello, I'm Dr. Anthony Gonzalez. I'm a general, robotic, and bariatric surgeon down here in South Florida. I'm born and raised in Miami, went to college at the University of Miami, and went to medical school at the University of Miami School of Medicine. I've been in private practice here in South Florida at Baptist Health since the late 1990s. I am the chief of surgery at Baptist Hospital in Miami. I run the bariatric surgical program as the medical director of the bariatric surgical program for Baptist Health. And I'm the founding program director of the Minimally Invasive and Bariatric Surgery Fellowship. That is a fellowship where surgeons spend a year with me after residency to learn advanced robotic and bariatric surgery. Today, my practice is 70% general surgery. General surgery involves conditions like hernia, gallbladder, reflux, and even colon surgery. And 30% of my practice is dedicated to bariatric surgery or weight loss surgery. All of these operations are done through minimally invasive robotic approaches as my experience as a robotic surgeon. Now, let's discuss a few common conditions that I deal with on a daily basis. Now we're going to talk about large incisional hernias. We're going to talk about hernias that are caused by previous surgery. So remember what a hernia is. H for hernia, H for hole. A hernia is a hole. And now we want to focus on large hernias. If you've had a large surgery, a piece of your colon removed, a piece of your stomach removed, a piece of your liver removed, and now you have a big hole, that is called an incisional hernia from a previous incision. Those hernias will cause bulging, will cause discomfort, will cause disfigurement, will cause pain. And obviously these hernias can also cause infarction, strangulation, incarceration as well. So it's very, very important that if you're having these large hernias that you seek care. So how do we treat these large incisional hernias, these hernias from previous incisions? Well, there's really no medication for this. You could wear an abdominal binder girdle, but that's just going to keep everything inside. It's not going to solve the problem. That requires surgery. And these operations are obviously larger operations. These hernias are too big to be done robotically through small little incisions. So they're going to have to be done with an open incision. You're going to need reconstruction of your abdominal wall. You're going to need a piece of mesh in there to reinforce the whole area. So these operations, understand, take 1 to 2 hours to do. You will spend at least one night, if not 2 nights in the hospital. You'll wake up with drains. You'll wake up with an abdominal binder and a new incision. That's because these operations are large and complex. And during these surgeries, we place a large piece of mesh, we suture the mesh in place, and we close your musculature and we close the hole. After a day or 2 in the hospital, you'll go home. You'll go home with your abdominal binder, you'll go home with your drains. We send you home with pain medication and antibiotics. Then you see me in the office every week for the first few weeks. Usually it takes 2 weeks, 3 weeks, 4 weeks to get the drains out. And then you need to wear the abdominal binder for 1 month. These operations really take about a month to recover from them. Overall, you can return to your activity in regard to exercise within a month. You can return to heavy lifting in a month, but it really will require 1 month to recover from these operations. Complications from these surgeries, they are big operations, so bleeding can occur from these operations. So obviously we watch for bleeding. We watch for bleeding when you're in the hospital. We look at the drains and make sure there's no bleeding. Also infection. Because there's a large incision, bacteria, it's your own bacteria from your skin can get inside and you can get infections. That's why we put you on antibiotics before surgery, antibiotics after surgery. We send you home with antibiotics and we have drains in there. The other complication that people are concerned about is recurrence. In other words, can these hernias come back? Well, the larger the hernia, the higher chance a hernia can come back. If the hernia is from a previous surgery, the higher chance the hernia can come back. Now, depending on what literature you look at and what publication, the chance of these hernias coming back are anywhere from 8% to 20%. Overall, the chance that you'll see these hernias again is around 10%. So there's a 90% chance when we repair these hernias, we reconstruct your abdominal wall, we place this mesh, there's a 90% chance you'll never see these hernias again. So we have covered incisional hernias, large hernias that are not amenable to robotic, minimally invasive surgery. They require large open incision operations with a large placement of mesh, reconstruction of the abdominal wall. Because the operation is much larger, the reconstruction is more extensive, the recovery is more difficult. You'll spend a day or two in the hospital, you'll go home with drains, but after a month, you'll be back to your normal activities. Once again, Dr. Anthony Gonzalez here, educating you on another surgical topic. Thank you.